So herd immunity, Nikisha, I'm really glad you asked that question. So this is what it is. And actually originally was an agricultural term. Herd immunity. If you imagine everyone in a community or a herd of people living together, if there is an infection and no one has immunity to it, it will wipe out a good part of the community. It will wipe out that herd. But if most of the people in that population, in that herd, have immunity, then even those who are not immune will be protected, because you can't get an infection if you're surrounded by people who are protected. And so herd immunity is when you get most of the population immune to an infection so that everyone in the herd is protected.
First, I would like to thank our panelists for carving out time from their busy schedules to educate and equip us with the knowledge that we need regarding the COVID-19 vaccination. We have Dr. Frita, nephrologist, who is the founder of Midtown Atlanta Nephrology at Emory University Hospital in Midtown. Dr. Frita, give us one fun fact about yourself.
One fun fact, where do I begin? So yes, I am a practicing nephrologist, but I was also board certified in internal medicine, pediatrics. And so I really like to talk about just about all medical topics. And so what I did about 3 years ago was I decided to start a YouTube channel. And my youngest daughter, who was 7 at the time, saw me fiddling around with my camera phone and my tripod. And she said, "What are you doing?" I said, "I have a YouTube channel." And she said, "That's great. How many subscribers do you have?" I said, 3. And she said, "That's sad." So from then on, she vowed to help me, as did my other 2 kids. And so my YouTube channel has become a bit of a family project. But the fun fact is that we have now blossomed to over 250,000 subscribers. But quite honestly, my YouTube channel, Dr. Frita, started as a pity project out of an abundance of shame from a 7-year-old.
What is the difference between the Pfizer, Moderna, and now Johnson & Johnson vaccines? Which one should I get if I'm given a choice?
Thank you for that question. And that is the question of the hour, given that the Johnson & Johnson vaccine just received emergency use authorization. So now we have 3 vaccinations in the United States, and that's wonderful. So let's first talk about the Moderna and the Pfizer vaccines. And as Dr. Holder just described, these are the messenger RNA vaccines. We want to look at efficacy, which is how effective is the vaccine? If I get a vaccination, how likely is it to protect me from getting the COVID-19 vaccine? So with the Pfizer and Moderna trials, together they had over 70,000 participants. And we found that with the Moderna trial, that if you get that vaccine, if you get both doses of the vaccination, then you have a 94% chance of not getting moderate to severe COVID-19 disease. You won't get sick or feel sick. And if you get the Pfizer, both doses, you get a 95% chance of not getting sick. So the Moderna and Pfizer's have 94 and 95% efficacy. And what's even better than that is that you have a 100% chance of not dying from COVID-19 or getting severely ill if you have the Pfizer and Moderna. So now let's fast forward to the Johnson & Johnson. Also a robust trial. This one was done on 3 different continents. It was done in South Africa, it was done in South America, and in the United States. Now with the Johnson & Johnson vaccine trial, it was done later than the Moderna and Pfizer, which started their phase 3s back in the summer. And when it was done, we found that globally, all around the world, it has a 66% efficacy, a 66% chance of not getting moderate to severe disease, and specifically in the United States, a 72% efficacy. And so people hear those numbers and they're like, I don't want that. Who wants the Johnson & Johnson vaccine when it's not as effective? But here's a really key detail with the Johnson & Johnson vaccine. If you get that vaccination, you have an 85% chance of not getting very ill or going to the hospital, and you have a 100% chance, according to the trials, of not dying from COVID-19. And that's the real key. We have over 513,000 deaths in the United States. And even if you get the Johnson & Johnson vaccination, you have a 100% chance of not dying of COVID-19. Now, here's another thing. The question was for me to compare these vaccinations, right? But it really may not be fair to compare, and I'll tell you why. Because the Pfizer and Moderna trials were done back in the summer, they were done before we had all of these variants. With the Johnson & Johnson trial, it was done after these variants, like the UK variant, the Brazilian variant, the South African variant. It was done after those variants arose. And so it's difficult to compare. We can't say that if the Moderna and Pfizer vaccines had been trialed right now, that they would have 94, 95% efficacy. And we also don't know, perhaps if the Johnson & Johnson trials happened back in the summer before the variants, they could have had more efficacy. I say that to say that it's not really exactly a fair comparison, but the important thing is regardless of the vaccination you receive, you have a 100% chance, according to the trials, of not dying from COVID-19. So even if you do fall in the United States on the other side of the 72%, say you do get COVID-19, with the Johnson & Johnson vaccine, you may end up getting something that feels like a cold, but you won't get severely ill, you won't die. So the bottom line is at this point, with this pandemic being so extreme, I recommend that you take the vaccination that is offered to you.
Great, thank you so much. And the Johnson & Johnson is only one shot, right? Versus.
Yes, absolutely. It's a one-shot deal. Yes, with the Pfizer Moderna, it's 2 shots. With the Moderna, 28 days apart. With the Pfizer, 21 days apart. And they have certain storage issues, like they have to be stored at very cold temperatures. But the Johnson & Johnson, it's a one-shot wonder. So you get that vaccine and you have your immunity. Also, it doesn't have to be stored in very cold temperatures. It can be in the refrigerator for like 3 months. So this actually has some global health benefits. If you're dealing with a transient population, like a homeless population, they can get that Johnson & Johnson vaccine and be done. If you're dealing with a population that has a difficult time taking off of work or traveling to a vaccination site, they can get this one vaccine, they get that vaccination and they're done. And so it has a lot of practicality. We've had to do a lot of math, Nikisha, in dealing with Moderna and Pfizer. It's like, oh, okay, if we get 200 doses, that's 100 people, but not with the Johnson & Johnson. They say they have 4 million doses ready to go out. That's 4 million people who are one and done vaccinated. And that will get us closer to that herd immunity that we're all trying to reach.
Dr. Frita, you touched on this with your first question, but let's expound. What is this herd immunity that everybody's trying to get to? Unmute.
Am I unmuted?
Yes.
All right. So herd immunity, Nikisha, I'm really glad you asked that question because at some point in the media, it seemed like herd immunity was demonized or something that people were complaining about. And now we're saying, oh, let's try to get to herd immunity. So this is what it is. And actually originally was an agricultural term. Herd immunity. If you imagine everyone in a community or a herd of people living together, if there is an infection and no one has immunity to it, it will wipe out a good part of the community. It will wipe out that herd. But if most of the people in that population, in that herd, have immunity, then even those who are not immune will be protected because you can't get an infection if you're surrounded by people who are protected. And so herd immunity is when you get most of the population immune to an infection so that everyone in the herd is protected. So in the case of COVID-19, at one point when things were really controversial, you had certain physicians and certain scientists suggesting that everyone should just run out and get the natural infection, go get COVID-19 so we can hurry up and get to herd immunity, get to it naturally. Well, here's the problem with that. So many people are at risk from dying from the actual COVID-19 disease. And so if they all run out and try to get the infection naturally, then you'll have a great loss of life. The other thing is even if you have survival, people with COVID-19 often need to be hospitalized or on the respirator. So then you could really overwhelm the healthcare system and have a major crisis and even more deaths if everyone just ran out. So getting natural herd immunity, in specifically the case of COVID-19, was not a feasible or a safe recommendation. However, now that we have 3 vaccinations with emergency use authorization, now we can achieve the immunity through the vaccinations. And in the case of COVID-19, we feel like if we get approximately 80%, maybe 90% of the population to be vaccinated and to get immunity, then even for those people who have not been vaccinated yet, or for those people who cannot get vaccines, they will be protected because they have a protective herd. Most of the people in their community are protected. So that's the concept of herd immunity. And that is why we're striving to get that great percentage, anywhere from 70, 90% of the people vaccinated to protect our community, our herd.
Awesome. So we all have to do our part.
7.8% of the US population is fully vaccinated. So now we have a lot of people who've had the vaccines, they've had the vaccinations, and we have some information. And here is the issue. You can have a correlation, like someone can die and someone can have the vaccine, but that's not necessarily causation. And so the real key is figuring out, can you die as a cause of getting the vaccine? Are the vaccinations causing people to die? Because that's what's out there on the internet. And the answer is thus far, no. We saw that in the trials, no one died as a result of getting the vaccinations, and that's across the board. Here's the great thing, especially with this new administration, we are seeing a great deal of transparency. And there's actually a morbidity and mortality COVID-19 safety and monitoring project where all of this information is being looked at. And I can give you a snippet of the data. From December 14th to January 13th, there were 113 people who did receive the vaccine and who did die, because I want to be very transparent. So now we delve into it. Of those 113 people who died, 65% of them were in long-term care facilities, like nursing homes. So then when further research was done, we found that in that demographic, the amount of people who did die matched their death rate anyway. In other words, there was a correlation. They had the vaccine, the vaccination, and they died, but they matched the same death rate that they would have matched anyway. It was not a cause and effect. So thus far, we have not found the vaccination to be the cause of death. But again, with this new administration, things thus far seem very transparent. And so if this information changes, we will report it. It will be reported. So there's a lot of misinformation, a lot of disinformation. And unfortunately, sometimes there's just enough tiny bit of truth for it to be believable. But what I really want people to do is go to your physicians, speak to physicians, scientists, healthcare providers that you trust to really try to debunk the myths. And so I'm very glad you asked that question, Nikisha.
Thank you so much, Dr. Frita.